We're going to study the skull. The skull is made up of a large number of bones which are flat and some of them are irregular in shape. So we are going to identify the bones making up the skull, the bones that are making the upper round part, the cranial vault, and then we will also identify the bones making the facial bones. This round bone with red color is frontal bone. As we move on the top, we can see on the upper sides, the supralateral sides, two of the parietal bones. We're looking at two of the parietal bones on the two sides, and then towards the back we can see on the posterior side we can see the bone that is the occipital bone, shown here in green color, this one again. So we have identified the frontal bone on the front, the two parietal bones, and we have identified the occipital bone. Now looking at the lateral view of the skull, we are going to identify, it's a view that will that is going to show us the one side of the parietal. This bone here is the temporal bone, and then here we are looking at the cheekbone, which is zygomatic, and this is the upper jaw maxilla. This bone here is the sphenoid. It will be at the base of the skull. I'm going to take it out, and that will be holding up a lot of the bones here. We are looking at the base of the skull. So here, starting from posterior side, this is the occipital bone. Then right in the center at the base, this bone is the sphenoid bone, and it's very important because it is the one that is going to hold a lot of bones which are on the front or to the side. This bone we already identified is on the side is the temporal bone, and here in the front is the palate. So we are going to identify the maxilla that is going to contribute to the palate, and this in green color is the palatine bone. Now here in the center is a thin bone that extending towards the front. This is vomer. Let's repeat them. So starting from posterior side, this is occipital. The bone on the side is temporal. The bone in the middle is sphenoid, and here is the hard palate. It is made by the palatine process of maxilla that we'll study later, and here is the palatine bone itself. Right in the center we can also see the bone that is vomer. Now since we can see that the two maxilla are separated, so we can also see a bone that will be there in the nasal cavity, behind the nasal cavity, and this is going to be the ethmoid. This is the lateral view of the skull. Let's repeat. Here is the frontal bone. This is the parietal. This is temporal. You can see part of the sphenoid, and here is the cheekbone, zygomatic, and this is maxilla. The frontal view of the skull also shows here is the small nasal bones over here, these two, and then here's where you're going to put your glasses when you're putting them on here at the on your nasal bridge, and down here this is the bone which is the ethmoid. So let's repeat it. Frontal bone, nasal bone, this is the maxilla, and in the center is the ethmoid here. In your exam, we will be using the non-colored skull. So we are going to identify the structures that we just identified right now. So I'm going to separate the lower jaw mandible and keep it on side, and we'll talk about it later. So looking at the bone over here, so this is the upper jaw maxilla. Here is the frontal bone. The frontal bone is then attached to the two parietal bones. You can see so two parietal bones, the left and the right, and here at the back is the occipital bone here. Now all these bones, they are joined with the help of these non-movable fixed joints, like your knuckles, they can fix and interdigitate like that. So these are the sutures. So this is a suture over here, and then you can see a suture over here connecting the two parietal bone. We'd like to know their names, so let's go ahead and talk about them. So this suture is known as the coronal suture, which is connecting the frontal bone with the two parietal bone. The two parietal bone in the middle are connected by this suture, which is right in the middle. So this is at the mid sagittal plane. So this is the sagittal suture, and behind, the two parietal bones are joined to the occipital bone with the help of this suture. So this suture here is known as the lambdoid, like the Greek letter lambda. So this is the lambdoid suture. On the side, the lateral view, we can see the temporal bone. The temporal bone is connected to the parietal here at this suture. Since this area is flat, therefore this suture is known as the squamous suture. Let's repeat our sutures, what we have talked about. So this suture is in the coronal plane. So this is the coronal suture. The one in the center is the sagittal suture, and the one at the back is the lambdoid suture. Now, we would also identify the bones once again: the frontal bone, the parietals, the occipital bone, lateral view, temporal bone. Then the bone here, which is making the cheekbone, is the zygomatic, and here is what is the upper jaw maxilla. You see the nasal cavity, the bone behind the nasal bone at this level, behind the base deep, is the ethmoid that we saw earlier, and this bone is here, and it is located deep at this level, deep inside. So it is in this shape, and that's how it will be located deep inside at this level. The nasal cavity has a part of the ethmoid that is extending down as the perpendicular plate, and down it blends with a very thin bone at this level, which is going to be the vomer. And here, this projected area is where the two maxilla bones are uniting. This projection on the lateral wall of the nasal area is known as the concha. This is the inferior nasal concha, and this one on the top is the middle nasal concha. These are the two that are contributed by the ethmoid bone. Now we are going to talk about individual bone, and we are only going to discuss and identify the parts that are given in your lab manual. So we are going to start up first with the temporal bone. So temporal bone, as you can see over here, it is going to be having a flat area over here, and then the parts to be identified is a hole. This hole is external acoustic meatus, and from at the back of it is a round structure, so round like a breast, therefore the name is mastoid process. And then a part of it extends anteriorly toward the zygomatic bone. This projection going forward is known as the zygomatic process of the temporal bone. Then there is a sharp, you can see the correct angle over here. This sharp structure is extending down. This is like a sharp, like a needle-like. Styloid is if you have a rounded wood and you cut it at one side just to sort of hammer it down into the ground, like to make a fence. So sharp at one side is styloid. As you can see that it is sharp and thin. That's evident at this angle here. So this is the styloid process. I would repeat the parts. This is external auditory meatus. This is the mastoid process. Then the projection going anteriorly is the zygomatic process, and this sharp is the styloid process. Now we are going to talk about the occipital bone. The occipital bone is the bone at the posterior side. It has got these horizontal lines running. This is superior knuckle line, and here is the inferior knuckle line. At this point, the occipital bone is a bit prominent. We call it as external occipital protuberance, and the superior nuchal line and the inferior nuchal line. As I'm going to turn it down, you can see the inferior view, which is the base of the skull. So the occipital bone has a very large hole. This is the largest hole in the skull, and it is known as foramen magnum. The brain continues down as a tubular structure, which is the spinal cord, through this foramen magnum into the vertebral column. Two round curvy bony parts over here. This is the occipital condyle. So the skull is going to sit upon the first vertebra and these two are going to sit upon the first vertebral vertebra. So that is the two condyles. Now we are going to talk about the next bone, which is the sphenoid. Now sphenoid you have already seen at the base of the skull. So if you look at the sphenoid bone, it looks like a pterodactyl from the old 1,000 million years back. As you can see it from here, this is the body of the sphenoid, this hole, and then it seems like it has got two wings. So this is a bigger wing and this is a smaller wing. We are going to call them as greater wing and a lesser wing. Now these two projections here, they are not included in your study, therefore I'm not going to get into their detail, but you can see these two bony projections down here. These are the pterygoid plates, but they are not required for you to memorize it. So when this is present, I'm going to open up the skull and we are going to look into it. So when we look into the skull, and this is anterior and this is posterior on this side, so we can see the skull to be divided into three depressions: the anterior cranial fossa, the middle cranial fossa, and at the back is the posterior cranial fossa. So the sphenoid bone actually sits down over here deep, and it is going to hold up the occipital bone, the temporal bone, and frontal bone. So it's a very important bone that's actually holding up. Now the word sphenoid is that it looks like a wedge. So if you look at from side view, it looks like a wedge like this, and that's from where the name comes up, that it is like a wedge, sphenoid. The parts that you need to identify are, first let me identify them on the colored model. So here, this is a big depression in the center. This is known as the sella turcica, and sella is like a Turkish word for saddle, a Turkish horse saddle, and here the pituitary gland will be located. This is the lesser wing, and here down this is the bigger greater wing. So the lesser wing and the greater wing. Also, when I slightly turn it on this angle, you can see it has got a small hole over here. This hole here, I would repeat and identify, this hole here is the optic canal, and then if I slightly turn it, I see a sort of the slit over here. This is going to be the orbital fissure. Let's see this bone on the actual model. So this is anterior and this is posterior. Here is the sphenoid bone, and the center, this depression is sella turcica. This is the lesser wing, and down here is the greater wing. If I slightly turn it, now you can see the hole. This is the optic canal, and down here is the fissure. I'm going to turn it and you can see the hole and the fissure on the inside. Now if you see it from here, this hole is the one that we spoke about, is the optic canal, and here is the fissure. The orbital fissure is here. Next we are going to talk about the bone which is ethmoid. Now ethmoid, as we talked earlier, is going to be present behind at the nasal bridge. It's deep at this level. So from here, if I am looking at, it's going to go deep into it. So here this portion is going to be at this level and deep. So you can see it has got a projected area over here, and these are a number of small holes, and the body has a cavity in it. So most of the cranial bones, their bodies, they are empty from inside, and an empty space is known as a sinus. We'll talk about the sinuses later on. Let's identify the part of the bone that is protruding up. So this projected part that you see here, this central projection, this is known as crista galli. Crista galli means the comb of the rooster, and down here are small holes. These holes are for the first cranial nerve, which is going to be the nerve that's going to carry sensation of smell. Its nerve fiber pass through these small holes. This area is known as the cribriform plate. So the cribriform plate here has got small holes. The cribriform means like a sieve. As you can see, it's an instrument which has got these perforations at the bottom so that the liquid can filter through it. So there are numerous holes over here, these small holes that you can see on two sides. This is the cribriform plate. The cribriform plate has got numerous holes for the nerves, the first cranial nerve are going to pass through this. And then here is the raised area, which is the cristogalli. So to this, they are covering around the brain, and they are going to attach to give stability to the brain. This is the cristogalli over here. Looking at the anterior portion of the skull, we are looking at the nasal bones over here. So this is going to make the nasal bridge. So two nasal bones, one on this side, small, and one on the other side over here. So this is the nasal bone on the other side. You can see its boundaries over here. Now this is the upper jawbone maxilla. It extends up as a small bony projection, and then on the inside here is the orbit, but on the inside there's a small depression with a hole. This bone over here with the depression is the lacrimal bone, and the duct for the tears and the fluid to pass down from here to the nasal area. You can see that. So this is the lacrimal bone. Let's identify. Here are the two nasal bones. Here is the maxilla, the upper jawbone, and on the medial side of the orbit is the lacrimal bone. This bone here is the cheekbone, the zygomatic, and it is going to combine and articulate with this projection. This projection was the zygomatic process of the temporal bone. Now if I put the skull, you can see the base of the skull. So this is the maxilla. This is the hard palate. So this part of the maxilla is contributed by maxilla. This part of the hard palate is contributed by maxilla. This is known as the palatine process of maxilla. So from here until here, this is the palatine process of maxilla on the two sides. And at the back here, this is the palatine bone, the left and the right. So two of them, and similarly here, the palatine process of maxilla. Another bone that we wanted to identify was the vomer. So vomer is a thin bone that is down here in the nasal cavity. It's like a plow, as you can see. In old days, they used to prepare the land for agriculture and use oxes or horses. So this looks like a plow that would be plowing the land. It's thin, and it is down here below the contribution of the ethmoid down here. So it will be down here, and then this projection is not vomer. Vomer will be at this level, and down here, this is where the two parts of the maxilla are combining and making a small projection over here. The lower jawbone mandible, as you can see here, we are going to identify the parts. It's going to be looking anteriorly from here. The teeth, they are in the sockets known as the alveoli. So these are the alveoli where the teeth are going to be embedded in. We are identifying these two holes on the region which is your chin. So this area is known as, the region is known as the mental. So this hole is known as the mental foramen. Then the jawbone makes a curve, and here you can find two bony projections. One is around, this is the mandibular condyle. It is going to fix onto the temporal bone, and this is a sharp raised portion here, this projection here on anteriorly. This is the coronoid process. So this is the coronoid process, sharp and thin, as you can see, and as compared to the round condyle. So the round condyle and the coronoid process. On the inside, if I turn it this angle, you can see another hole which is located here. This is known as the mandibular foramen. So the nerves that supply the inner area of the mouth, the tongue, and other muscles, those nerves are going to be going in from here, which is the mandibular foramen. Let's repeat. On the front is the mental foramen, two bony curves, mandibular condyle and coronoid process of the mandible, and then one hole on the medial side of the bone. This is the mandibular foramen.